Network 2's TED Talk will be on our integrated centralised recall. So let's have a look. Before we had decentralised recall, when this recall work was done by network staff at individual practice level. We then formed centralised recall. This was based on having a dedicated team of recall administrators centrally based. This was then developed into our integrated centralised recall. So what is integrated centralised recall? Put simply, it brings together key components of the entire system to optimise delivery and create efficiency. We will now go through some of those key components. Our centralisation pack essentially governs how the network works with member practices. It outlines key roles and responsibilities for both parties and details the system and processes used. It also ensures a nominated person from each practice works with the network recall micro team. Our shared telephony system. This creates a seamless flow, allowing the network team to alleviate access pressures at the reception by diverting calls straight to our dedicated recall team for all queries and appointments relating to LTC. Our online interactive dashboard enables practices to stay connected to change in NIS performance. We have linked the dashboard via RSS feeds into each EMIS system across the network. Performance reports are generated on a monthly basis that are used to analyse performance and generate discussion during our practice visits. The development of our network website is part of our digitalisation plan to improve online access and divert appropriate traffic to our website for information and simple self-referrals. Our Twitter account has expanded our online reach and has helped establish collaborative partnerships with a diverse group of different organisations. Recall data, audit and lists. Regular audits of patients who are due for appointments ensure the network's recall team calling patients who have DNA'd their past appointments and those that are not appearing on the recall list for a number of reasons, mainly around incorrect read codes. Regular monthly recall lists with back-end tracking features and recall statistics ensures patients are called in when they are due, as well as ensuring the network SMT is aware of recall activity. Our revamped clinical lead role does away with looking at disease conditions in a singular perspective. By embracing principles of holistic, integrated, whole-person centred care, this role merged roles that were previously separate and explores and emphasises comorbidity issues as well as impact on wider determinants of health. Network-based engagement and awareness events such as pop-up clinics at the Whitechapel Market and health fairs at the Whitechapel Idea Store was part of our broader LTC comms strategy to create local involvement and ownership as well as general awareness around LTC. Health Passport. The network has launched a health passport for our diabetic patients in order to assist patients in learning more about their HbA1c levels affect their health, as well as enabling patients to take more control of their own health. This passport is a folded business card sized card that the patient keeps with them and brings on their annual and interim reviews. It highlights the patient's HbA1c level with an easy to understand colour code, informing them if they are in a managed zone or not. The card passport also includes useful information and reminders for patients such as contact numbers for the diabetic centre and the retinal screening service. All the components and the entire recall system is underpinned by strong relationships and aligning processes based on practice culture and way of operating. So how does an integrated centralised recall system work? Through developing the right system IT infrastructure, namely in our case EMIS and our shared telephony system, having the right organisational wraparound is important to legitimise and make clear the employment structures for all concerned. Underpinning all of this is the model that is centred on people and relationships. That is why the practice visits and the clinical lead role is all about making sure there is constant and regular communication with practices, and absolutely wherever possible, the recall function is adapting and delivering to the needs of individual practices. So what has this achieved? It reduced access pressures on reception teams by diverting calls to our dedicated recall team. This not only reduced incoming calls to the reception teams, but also reduced the number of abandoned calls. It also helped improve NES performance. This was done through bespoking processes to individual practice operations with an overarching standardised model that highlighted and focused on the key deliverables. It also ensured there was greater supervision and productivity to ensure maximum efficiency was gained. The third key area of achievement is our shared deployment of resources. This is made up of our dedicated recall team, which consists of 3 call and recall administrators and 3 apprentices, as well as our dedicated LTC nurse and our currently vacant HCA post.